What is oliguria? Have you ever noticed your pet not urinating as much as usual? This could be a sign of a condition called oliguria. Oliguria is a medical term that describes the production of an unusually small amount of urine. In veterinary medicine, understanding oliguria is important for assessing the health of our furry friends, especially dogs and cats. Typically, normal urine output for these pets ranges from 1 to 2 milliliters per kilogram of body weight per hour. When this output drops significantly, we see oliguria. There are two main types of oliguria to be aware of. The first type is physiologic oliguria. This occurs when the body is trying to conserve water. It often happens in situations like dehydration or shock, where there is reduced blood flow to the kidneys. In this case, the urine produced is highly concentrated, showing that the kidneys are still working to retain water. The second type is pathologic oliguria. This is more serious and indicates that the kidneys are not producing enough urine to remove waste properly. Pathologic oliguria can signal acute renal failure or other kidney diseases. It is diagnosed when urine output falls below 0.5 milliliters per kilogram per hour. So, what causes oliguria? There are several potential causes, including kidney diseases, heart problems, infections, and certain medications. Symptoms can vary but often include reduced or absent urination, straining to urinate, lethargy, loss of appetite, and signs of dehydration. Diagnosing oliguria involves a thorough physical examination, medical history review, blood tests, urinalysis, and sometimes imaging studies. Treatment will depend on the underlying cause. Often, veterinarians will use fluid therapy to rehydrate the animal and stimulate urine production. In cases of kidney failure, specific therapies may be needed to address the renal dysfunction. Recognizing oliguria is essential for early intervention in veterinary care. Veterinarians must quickly identify the cause and start the right treatment to avoid complications. Monitoring urine output and adjusting treatment strategies are key to managing oliguria effectively. If you notice any changes in your pet's urination habits, it is always best to consult your veterinarian for advice and proper care.